Hi everyone, welcome back to PharmaExplora. Today we are going to discuss another interesting topic, intravenous route of drug administration. So in our previous discussions, we discussed about the routes of drug administration. I hope you remember we divided it into three main categories, the enteral route, parenteral route and the other specialized pathways. So we define the enteral route as the route which involves the gastrointestinal system. So we further divided that enteral route into oral route of drug administration, sublingual route of drug administration as well as the buccal route of drug administration. And also we discussed the distinctive advantages and disadvantages of each route of administration. Now, let's think like this. What happens if a patient is unconscious or what happens if a patient cannot swallow a pill or swallow a medication, or and also if a particular drug is completely incompatible within digestive tract, and also if a patient is undergoing a medical crisis which every second, every minute counts. So the pharmaceutical scientist came up with solution for these questions. That is parenteral route of drug administration. So the intravenous route of drug administration is the most common parenteral route of drug administration. So this intravenous route of drug administration provides the maximum degree of control as well as the unparalleled speed rather than any other route of drug administration. But it comes with the advantages comes with exceptionally high the clinical stakes or clinical risks. So without further delay, let's discuss about this fascinating intravenous route of drug administration. Okay, first let's discuss what is intravenous route of drug administration. So, when we administer medication intravenously, we inject the drug solution directly into a vein. When we administer a drug solution intravenously, we inject particular drug solution directly into a vein. So, you can see as the name implies, this intravenous. Intravenous means into a vein. So intravenous means into a vein. So into a vein. That means we administer drug into a vein. So that is the meaning of the intravenous. And when we administer drug intravenously, we inject particular drug solution directly into a vein. So this is the most common parenteral route in clinical practice. So this intravenous route is the most common route of drug administration in parenteral route, among parenteral routes. And also the advantage, this is the advantage, this pathway completely eliminate the need for drug to absorb through the anatomical membrane. So as you can see, this pathway completely eliminate the need for drug to absorb through anatomical membranes. So, drug doesn't have to wait until it dissolves in the stomach or then navigate through long path of intestine and also pass through the strict checkpoint of liver. So, in intravenous route of drug administration, drug doesn't have to wait until it gets dissolved in the stomach or navigate through the long path of intestine and also pass through the strict checkpoint of liver. So instead, we directly placing the drug into the systemic circulation. We directly we directly place drug into the systemic circulation. So, and also we have previously discussed about the oral route of drug administration. If you want, if you miss these videos, if you want to have a quick refresher, I have put the links down below so you can go through it as well. And here we are discussing advantage. So in intravenous route, drug doesn't have to wait until it gets dissolved in the stomach or navigate through the long path of intestine and pass through the strict checkpoint of liver. Instead, we placing the drug solution directly into the systemic circulation. So this is the brief overview about what intravenous route of drug administration is. Okay, now let's discuss about the distinctive advantages of intravenous route of drug administration. So, the first advantage is the overcoming the oral barrier. So, in our previous episodes, when we discussing about the oral route of drug administration, we discussed that even though the oral route of administration is the most common, most safest, most economical, and as well as the most convenient route of drug administration, it is full of its challenges or the disadvantages. So such as disadvantages has overcome came by this intravenous route of drug administration. So the first one, the overcoming the oral barrier. So this is the ultimate alternative for medications that cannot be absorbed through the gastrointestinal tract. So this is the ultimate alternative for medications which cannot be absorbed through the gastrointestinal tract. The good example or the one example is rocuronium. This rocuronium is a powerful neuromuscular blocker which clinicians use during surgeries to relax the skeletal muscles. So, if we give this rocuronium orally, or if we give patient to swallow the rocuronium, there will be no effect. But if we give this rocuronium intravenously, you can get the instant effect. So rocuronium is very good example for overcoming the oral barrier by this intravenous route of drug administration. Okay, the second advantage of intravenous route of drug administration is maximum dosing precision. Maximum dosing precision. That means since there is no erratic absorption to worry about, the healthcare team has the absolute control of the exact amount of active drug circulating in the bloodstream at any given moment. So let me repeat it again. Because of there is no erratic absorption involved, why we are directly administering the drug solution into the vein, that means to the systemic circulation. So there is no erratic absorption involved. Therefore, the healthcare team has the absolute control over the exact amount of active drug circulating in the bloodstream at any given moment. So the healthcare team has the control, the absolute control of the exact amount of active drug circulating in the bloodstream at any given moment. So the healthcare team has the absolute power of control. So this is the second most advantage of this intravenous route of drug administration. Okay, So the third advantage of the intravenous route of drug administration is rapid dilution of irritants. Rapid dilution of irritants. So this intravenous route is highly advantageous for medications which are irritating human tissues. So this intravenous route is highly advantageous for medications which are irritating to the human tissues. So once you administer irritating chemical either through subcutaneously or intramuscularly, if you administer the irritating chemical intramuscularly or subcutaneously, what will happen? It may cause the severe localized pain as well as tissue necrosis or say tissue death. So if you administer irritating medicine or irritating chemical as a medication intramuscularly or subcutaneously, it may cause severe localized pain as well as the tissue necrosis, or in other words tissue death. So but if you administer this particular irritating chemical of medicine into a large vein, what will happen? In that particular large vein, you will find the high volume of rapidly moving blood. High volume of rapidly moving blood. So this blood dilute the substance almost instantly. Therefore, it will protect the surrounding blood vessel walls. So let me repeat it again. If you administer irritating chemical of the medication which is irritating chemical intramuscularly or subcutaneously, it may cause the severe localized pain as well as tissue necrosis. But if you inject this particular medicine into a large vein, within the large vein you will find high volume of rapidly moving blood. So this blood dilute the substance immediately, almost immediately dilute. Thereby, it protects the surrounding blood vessel wall. So this is one of the great advantage of this intravenous route, the rapid dilution of irritant. So these are the three main advantages of um, intravenous route of drug administration, overcoming the challenges in the oral route of drug administration and the maximum precision of the dose as well as the rapid dilution of irritants. Okay, now we are coming to the most critical part of our discussion. That is the disadvantages or challenges of the intravenous route of drug administration. Now let's discuss one by one. The first one is no recall rule. I hope you remember during our previous episodes when we discussing about the oral route of drug administration, we discussed that when we are giving the oral medicines, if we see unexpected toxicity or the accidental overdose, the process can be reversible to some extent by introducing the antidotes like activated charcoal or sometimes using the physical method. So the process can be reversible to some extent. But when it comes to the intravenous medicines, you directly insert medicine into the vein, or in other words, you are inserting medicines in directly to the systemic circulation. So once you administer drug into the systemic circulation, there is no physical way to recall it. So that is the first and the most important challenge of this IV route. So there is no physical way to recall it once you administer the medicine into the vein. And the second one is the risk of systemic infection. The risk of systemic infection. That means you are giving this intravenous medicine by injecting a needle directly into the vein. So you inserting a needle directly into the vein. So thereby you completely bypass the skin. So skin is the body's primary mechanical barrier against pathogens. So if any microscopic contamination at the site of the injection or the administration fluid can directly introduce the pathogenic bacteria or viruses into the blood. So this is very, you have to be very careful on this. So the risk of systemic infection. Why? Because you are inserting needle directly into the vein, bypassing the skin, our body's primary mechanical barrier against pathogens. So if there is any microscopic contamination on the site of injection or the administration fluid, those bacteria and viruses, pathogens can directly enter into the bloodstream. And our third challenge or the disadvantage is we can expect acute danger of speed shock and adverse the allergic reactions. So the acute danger of speed shocks and adverse blood reactions. So it's like this. If you administer the drug too rapidly into the vein, you can expect sudden increase of the plasma concentration of the drug. So this may sometimes lead to the devastating physical trauma. And also, since you are administering a drug suddenly, you are increasing the concentration, so the delicate vascular lining can subject to a chemical injury. So this may lead to this adverse blood reactions as well. So these are the main three disadvantages of the intravenous route of drug administration. So no way to recall it, and this risk of systemic infection as well as the acute danger of speed shock and allergic blood reactions when if you suddenly administer drug to the vein. So those are the disadvantages of the intravenous drug administration route. Okay, now we are coming to an interesting part. It's like this. How do we choose to deliver a drug intravenously is going to completely alter its pharmacokinetic profile in the body. So, how do we choose to deliver a drug intravenously is going to determine or is going to alter its pharmacokinetic profile in the body. Let's see how. Now, primarily, there are two methods of intravenous injection. Primarily, two methods. Those are IV bolus and IV infusion. So, IV bolus is the what we entire dose is injected into the vein all at once. So in IV bolus, what clinicians do is they inject entire dose of the medicine into a vein all at once. So what we can expect? We can expect the sudden spike of drug concentration at the blood into its maximum. Now, let me repeat it again. There are two methods of intravenous drug administration. The first one is IV bolus. So, in IV bolus, what clinicians do is they inject the entire dose of the medicine into a vein all at once. So, what will happen? We can expect a sudden spike at the drug concentration, uh, sudden spike or sudden increase of the drug concentration into its maximum. So that is the IV bolus. So thereby what we can expect, because we are increasing the drug concentration into its maximum instantaneously, we can expect the immediate therapeutic effect. So that is most important part. The IV bolus, we can expect the immediate therapeutic response, immediate therapeutic effect. So in IV bolus, we can expect the immediate therapeutic effect. Why? Because clinicians in IV bolus inject entire dose of the medicine uh, at once. So thereby the drug concentration uh, going to its peak or to its maximum instantaneously. Thereby we can expect immediate therapeutic response. The other method is IV infusion. So the IV infusion, what will happen? The medication is diluted in a large volume of fluid and delivered slowly through an infusion set over an extended period. So, in IV infusion, what will happen? Medication is diluted in a large volume of fluid and delivered slowly through an IV set and over an extended period of time. So, there you can expect much lower, safer peak drug concentration level. So there you cannot expect sudden increase. There you will expect a lower, safer peak drug concentration levels. Why? The medication is diluted in a large volume and it's delivered slowly and also through an infusion set over an extended period of time. So in IV infusion, you can use to have extended or longer duration of therapeutic effect. So IV infusion provides extended or longer therapeutic effect. Extended therapeutic effect. So those are the two main methods of intravenous drug administration. So let me repeat it again for your clear understanding. How do we choose a drug to deliver intravenously is going to completely alter its pharmacokinetic profile in the body. So we just explained how. So there are primarily two methods of intravenous uh, injection. So those are IV bolus and IV infusion. So in IV bolus, what we do is the entire dose is injected into the vein almost instantly. So there you can expect a spike to its maximum drug concentration level instantaneously. Therefore, you can have an immediate therapeutic effect in IV bolus. When it comes to the IV infusion, the other method, you provide the medication. Initially, medication is diluted in a large volume of fluid and it delivered slowly through an infusion set over an extended period of time. So rather than expecting a peak drug concentration level immediately, here you can expect much lower, safer drug concentration level. So we use IV infusion to have extended therapeutic effect or longer duration of action of the particular medicine. So this is the brief overview of methods that we are giving intravenous medicines. Okay, to summarize today's session, we discussed about incredible fast acting, the intravenous route of drug administration. So in there we discussed about its what is intravenous route of drug administration, what are its primary methods, as well as its distinctive advantages and disadvantages as well. So if you found this video helpful, just hit the like button and subscribe the PharmaExplora channel. And thank you very much for joining with PharmaExplora today and see you soon.